It's a new day at the Bondi Clinic and Chris is walking into an ambush.
Hello.
Hey, Chris. Don't get to say hi to Sydney.
I said hi to Sydney many times. Hello, Sydney.
But not enough.
Two of the vet nurses here at work, Liesl and Louise, are mounting a not-so-subtle campaign to get me to adopt one of the orphan kittens here. You know that I like Sydney.
So just adopt him.
They've called him Sydney Brown as a preemptive way of making him, I guess, half mine already. Look, he's now in a frenzy.
Every time he comes in afterwards, he's gone, there's a little squish, squish, and his heart's going thump, thump, thump.
Every single day I get a text message, supposedly from Sydney. It's not Sydney, I know it's you, Louise.
Yeah, well.
With him posing in some crazy outfit.
The universe wants him to go to you. Why are you fighting the universe, Chris? Why?
I think he's melting a little bit, you know, he's getting there.
But the arrival of one of Chris's regular patients, 3-year-old Ox, is about to give him a break from the peer group pressure.
Hello, mate. Good to see you. All right. Hello, buddy. I'm Ned here. What have you done this time? Yeah, it's good, isn't it? I bet it is good. Come on through.
Ox's owner, Matt, isn't sure, but he thinks his pug has swallowed an open safety pin.
He lunged at it and then it was gone. So it either's fallen down and we can't find it, or he swallowed it.
I'll just have a little look inside this mouth. Let's have a bit of a feel around, make sure it's not just in his mouth there. No, it's my finger.
He's a bit thick, I think, sometimes, but you know, he's a happy chappy.
We're gonna see if you can actually swallow food. All right, and see if you can keep it down. In a dog his size, it certainly possibly could have swallowed it, and with all the saliva and the mucus that he has in his mouth, it could actually travel quite easily down to his stomach. But from there, it might get a bit complicated. My hunch, I guess, if you like, is that it's not in there, but pugs are interesting. Pugs do funny things.
All right, so this one's our party-themed approach.
At the same time next door, Louise and Liesl are coming up with more tactics to convince Chris to adopt Sydney.
Sydney, look at the camera. Louise and I at this point are plotting to send Chris pictures every other day of Sydney, especially when he's not at work. And then when he is at work, we'll just keep introducing Sydney into every conversation, basically as much interaction with Sydney as we possibly can. So how could he not love you? Hey?
Is this your latest party trick, is it, Ox? The old open safety pin trick, huh? Right, the only test really that's going to be of use is the X-ray. So I'll take him through now.
Let's do it.
Okay, and I'll have an answer for you sooner rather than later.
Excellent.
Okay,
thank you.
It's amazing that something so small could cause such a huge amount of damage, but we're talking about a safety pin that is incredibly sharp and will perforate through, and when it pushes through the wall of the intestine, it takes millions of bacteria with it. And those bacteria inside his body, where they shouldn't be, would cause a really serious and potentially fatal infection.
You there, Lisa? How do you know little Gizmo has arrived? The little toxicity?
At the Bondi Referral Hospital SASH, 3-year-old cavoodle Gizmo has been rushed in, suffering from constant tremors.
My sister called me and she said that he'd vomited and to come home and clean it up right now. And then I got home and we couldn't find him anywhere, and usually he rushed us straight to the door and he wasn't there. And he was outside in the garden, like beside the house underneath the boot, and he was all in the mud and vomiting. So it might be he's eaten something, but we don't know what he could have eaten. So, and then rushed straight here.
Pretty worried.
He's all shaky and twitchy.
Well, this is basically our practice baby. So, yeah, pretty invested.
Hello, I'm Lisa. Hi. Lisa, nice to meet you. Hi, Sarah. Hi, Gizmo. Oh, shaky, darling, come through. Can pop him down on the ground and we'll just have a chat first. Also want to see what he can do. Not having fun at all. He's not a happy boy. Gizmo! Gizmo!
Come here, buddy.
Come to us.
Is he a barker normally?
He can be. He's gotten like a lot better. We've been doing like a lot of training and stuff with him, but he does have a tendency to bark.
Emergency vet Lisa Chimes is worried Gizmo may have been fed a poisonous bait.
We often see dogs that bark a lot and people try and poison them. So I guess at this stage we have no idea what's causing it.
You hear about that happening all the time and it's so sad. You hope for at least a phone call or a talk about it first before anyone resorted to anything that horrible.
The problem is that if he's got a toxin in his stomach, it's going to get into his system really, really quickly. So we've got to act fast to make sure that we can save this little guy, because I'm really worried that time's running out.
All right. Hey.
At the Bondi Clinic, Chris is trying to determine whether Ox has swallowed an open safety pin.
It's a good boy.
The big problem is that if Ox has swallowed this safety pin, given the fact it is open, then it's quite likely that it would actually perforate through either his esophagus, his stomach or his intestine, and from there it would cause intense pain, quite a serious infection, and quite honestly, it could kill him.
So we're looking for a really bright white object. There. No. He's fine. So, yeah, he's lucky. Very lucky. I think Matt will be very, very relieved. You wouldn't ever eat anything as stupid as a safety pin, would you? No, you're more of a liver treat sort of a guy. All right, the safety pin isn't here. No. Okay. So somehow he's managed to avoid it, but the question is, I don't know where it is now. I have no idea.
Well, it probably just dropped somewhere then, I guess.
Yeah.
Hey, oh, you're a lucky little bugger, aren't you? Hey, I guess they are safety pins after all.
That's right.
So Ox has been given the all clear, but Chris is still under pressure.
He's a good-looking cat.
Back inside, the campaign to make him adopt Sydney is relentless.
Look, I appreciate it, I do, but I don't know if I'm ready. But the fact is, my cat, George, only passed away a few months ago. He was 17. I'm just not ready to replace him.
Hello, how you going?
George entered Chris's life in the most dramatic way possible.
The problem we've got right now is the fact that we're battling hypothermia.
The cat had been locked in a cage and thrown in the Bondi surf. Rescued by police, he was rushed into the clinic to be resuscitated.
It's battling to try and get air in. It's been through absolute hell tonight.
No one wanted to adopt George, mainly because he was occasionally aggressive. But at the same time, there was this energy, this attitude that I just saw and loved him for. I take that as the sound that he just doesn't want to leave us.
No, he doesn't.
We've bonded, haven't we, buddy? Huh? The thing about George, he didn't exactly embrace visitors. There was no welcome mat that was rolled out. George, that's not a welcome. He's gone.
Do you have to inspect all visitors, George?
I had a penguin that I brought home as part of his rehabilitation, Harmon, and there was a moment where I was feeding him fish, and you look at George, he looked at the penguin and said, "No, I'm the only creature around here that eats fish. I've got no time for you at all."
You ever get the feeling you're being watched, Harmon?
You know, it's just not now.
All right, you know where he is.
I've got no doubt that Sydney will find a great home, and I hope they're as happy as George and I were. If someone comes in that really wants him, though, you let him take it.
We will. We'll see.
You've got to let them take
They
it.
have to be suitably special as well.
George passing was really sad, and so we're just waiting for Chris to be ready. Otherwise, we'll just keep waiting for someone to adopt him.
You've got other dogs to talk to, but just talk nicely.
At Inside Sash, little Gizmo is suffering uncontrollable tremors. Owners Daniel and Sarah are reluctant to leave their precious pet.
Good boy, okay?
Lisa is hoping a series of tests will provide some answers.
Good, Gizmo. Good boy.
After putting Gizmo on a drip, Lisa injects the cavoodle to make him vomit any toxins from his system. No clues there. Now Gizmo has to be tested for illegal drugs.
If he's picked something up that somebody's thrown over the back fence, or if he's picked something up on his walk, methamphetamines, cocaine, opiates, marijuana, I'm hoping that we get a negative result.
Good boy.
An enema is just another indignity for the miserable cavoodle.
What we're trying to do is get any toxin out, and hopefully once we remove it, it's going to alleviate some of the signs and also hopefully give us some clues as to what's going on. A job well done, nothing found.
With all the test results still giving Lisa no answers, she decides on one final treatment.
So I'm giving Gizmo some activated charcoal, and what that does is it binds to any toxin that's still in his gut, and it's going to prevent it from being absorbed. Swallowing. Good boy. Just tastes like dirt. Come on, honey, swallow it. Good boy. Here we're making a mess. In your hop. I've done everything that I can for Gizmo, but he's still shaking. We just have to wait, and hopefully we've got everything out in time. We just don't know.
You have a good little sleep, honey.
Looking around, I've got to say, it is like you're in Africa.
Yes, yeah, I grew up in the big game reserves in Africa, and this is the best job I reckon I could have. Landscape-wise, there's a lot of it that feels like home, and certainly the types of animals you see around you.
Next day, Chris has arrived at Werribee Open Range Zoo just outside Melbourne. He's been called out to help with a very special patient.
You're worried about one of the cheetahs here?
Coyote has not been eating as he usually does. We hope that an examination will reveal if there is anything wrong, and with your help maybe we can get there and figure that out today. We heard that cheetahs are one of Chris's favourite animals, and I thought, why not give him a call so he can come and help out with the whole process. So we've got Inkasana on the left.
Yeah.
He's got a white patch on his tail, and Coyote on the right over here.
Brothers Inkasana and Coyote have been residents at the zoo for more than 7 years.
So what's got you so worried?
Well, I've just noticed with Coyote, he hasn't been eating as he normally does. They normally have relatively small meals. They don't sort of go for days without food, like lions, for instance, eat a big meal and then maybe go for a few days without. These guys tend to eat most days. Not eating is unusual for him, you know. I thought
If any cat has a weakness, it's going to be their kidneys, isn't it? And with these guys, as they're getting on, the kidneys are going to become more and more of an issue.
Kidney problems are common amongst both big and domestic cats, especially as they get older. One of the biggest killers is renal failure. This happens when the kidneys are no longer able to remove waste products from the blood.
I guess what worries me is the fact that we're still talking about wild animals here, and for them to show any signs of illness, to give away any sort of sense of weakness is a big deal.
Yeah, and they wouldn't normally show it. I mean, that's exactly what I think, but hit the nail on the head.
These cheetahs are not just important to this zoo, they're important really to the whole world of animal conservation. Cheetahs are threatened, and so we have to keep them healthy.
I love them to bits. You know, it's a real honour working with these animals, so we've got to look after them. They're in our care, and we've got to do the best we can to look after these magnificent things.
I guess my biggest worry is that we find something today that just can't be fixed. If it was to be kidney failure, or worse still, a cancer that can't be operated on, then it'd be pretty devastating for all the team here.
I've just had a call from my mate Jason, who owns Hunter Valley Zoo. He's got a big gator, prime of his life, 3 metres, a couple of 100 kilos, and he needs a hand to move him in with a couple of girls.
The Hunter Valley Zoo is right in the middle of New South Wales wine-growing country. But this is not going to be a relaxing day off. Australian Reptile Park General Manager Tim Faulkner.
G'day, Jace.
Timmy, how you going, mate?
Good, mate. I'm excited.
Yeah, same.
Where is he?
He's buried in the mud there at the moment, mate.
What's his name?
Horse.
The big horse.
Big horse. Thanks heaps for coming up, Timmy.
Oh, mate.
Appreciate it, mate.
I love it.
So a bit of manpower is going to be good.
First, the water is being drained from the huge alligator pond. This 3-metre predator has no idea he's about to be introduced to his new harem.
Now, in gator years, he's in the prime of his life. He's ready for action. He's 20 to 30 years old and he's hitting his strides. It's ready for him to get a girlfriend.
All good?
Good. Time to go in, hey?
Time to get the boots off and get in?
Yep.
He's sitting there looking at us. You can tell by the fact that he's dug himself into the mud that he really knows something's up.
It's nerve-wracking in this mud, mate. He's lightning and we're stuck.
I know, and we've got a long way to go yet, and we're already nearly up to our knees, mate.
Kissy! Gizmo! Gizmo! Gizmo, you look so much better. Huh? Let's see how you walk. Let's see how you walk.
At Sash, Gizmo has made an incredible recovery.
You're all better. Gizmo, Gizmo, Gizmo. Who got fixed? Who got fixed?
The 3-year-old cavoodle is showing no signs of the shaking and tremors that had taken over his body yesterday.
We have no idea what caused Gizmo's signs. We ruled out a lot of things, but the exact cause of what happened to him will never be known, huh, Gizmo? It's a bit of a mystery.
After everything from an enema to a drug test, Gizmo is just happy to be going home.
Come on. Come on, Gizmo. Gizzy! Gizzy! Hello, puppy. Hello, puppy. Hello. Oh, are you okay?
You look much better. Yes, you do. Yes, you do. Thank you so much.
No problem at all. Hey, buddy? And you don't get into anything else, hey? You got to tell your mum what you get into next time.
Come on, Jemima.
At a park near Bondi, 6-year-old Jemima is struggling to walk.
There's no other speed but full speed with Jemima. She races everybody up and down the stairs. She's got to be out the door first. Slow down, Jemima. Last Sunday, she made a really dreadful sound out in the backyard and she was shaking and couldn't put a leg down. That's a girl.
For her owner, Jeanette, watching the short-haired pointer attempt to walk is heartbreaking.
She's like one of my daughters, really. She's just part of the family now and we love her dearly.
Come on. Oh, look at her leg.
Jeanette is hoping today's appointment with SASH specialist surgeon Andrew Marchevsky will give her some answers to Jemima's sudden lameness.
It's quite devastating to think that, you know, this could affect her for the rest of her life. Good girl.
Chris, come and meet our senior veterinarian, Nat Rourke. Nat, this is Chris.
Hey, Nat, how you going?
Good, Chris. How are you?
Good. Big day, huh?
Welcome. Yeah, big day for Coyote, big day for us.
Chris has been enlisted to help out the team at Werribee Open Range Zoo. 10-year-old Cheetah Coyote has stopped eating and needs to be examined to make sure he isn't seriously ill.
They start getting kidney failure as they get older, and so, yeah, I'd like to have it checked out. Take them both through.
Yep.
I'll close it down now. Thank you.
Okay, got both.
Fantastic.
All right, so what's the plan here now?
We need to get the brother we're not working on, Inkasana, he needs to be out on display. Coyote will want to go back to him, and at that point we're going to close him into the slide. I'll operate those slides, I'll get you to do this lot, and then we'll meet up with the rest of the team once we've got the dart in place.
The whole point of separating them is so we can actually draft off Coyote into this holding pen, and from there he can be darted.
Come on, just lift that slide, but don't let Coyote through. Inky, come. See how quickly he goes? He knows what's out there, so...
He's already grabbed that food there now.
He's got it now. Have a look at that.
For Coyote and Inkasana, you can really sense they get strength and they feel safety in numbers. But the moment one's missing, they freak out.
We're going to let him through now. Good boy.
I'll give that to you.
Come on.
The team has to work fast. Coyote needs to be lured into the crush so that he can be darted.
Boy.
Come on, buddy. So, look, the pacing and the obvious awareness that something's going on, it doesn't make this easy.
Please. Good boy. Boy, Katie. This is where he knows something's up.
Each time he tries to go through, doors are shutting in front and behind him. He's starting to panic.
Good boy, Katie. It's okay.
There we go. Yeah.
Well done. Thanks, Nat.
We finally got him in the chute. It's time to dart him. This has to happen quickly.
Good boy, Katie.
Yeah.
Nicely done.
So we've got most of it in there. You can see that the needle's gone about, 3/4 of the way in, so we're thinking that most of that drug should be in.
We can expect anything when an animal goes under anaesthetic, but I'm hoping he'll be okay.
Easy, boy. Easy, buddy. Just settle down, buddy. Come on. I guess if there's one thing that worries me about this whole thing, it's the fact that the stress of being darted could result in him flipping out. If he does that, he could break his leg, injure himself in a really bad way, and that would be absolutely catastrophic.
It's all going to be okay. It's going to be just fine.
Jeanette has arrived at Sash with Jemima. The short-haired pointer is struggling to walk.
I'm feeling a bit sad, really, to think that she's got could be potentially a very serious injury. She's the baby. She's my third daughter, and we all love her dearly.
Jeanette.
Yes.
Hi,
Andrew.
I'm Andrew Marchevsky.
How are you?
I'm well, how are you?
Well, thank you.
There's no guessing which leg she's on, is there? Come on in. Oh, wow. So what happened?
Well, for a few months now, she's been on and off lame.
On that leg?
Yes. Sunday afternoon, she made an enormous sort of screeching noise.
Okay.
She was at the door shivering and her leg was pulled right up.
For a dog not to use a leg, she's really sore.
We've noticed it's a very grindy noise.
Crunchy. Yeah. Good girl.
Specialist surgeon Andrew Marchevsky examines Jemima's leg for any clues as to what's causing her lameness.
No, she totally ruptured a cruciate. Haven't you? Oh, footballer's injury. The cruciate ligament keeps your knee stable, so when you're walking around on it, it stops it from sliding around randomly. She's been charged around the backyard and suddenly it's snapped, and that's pretty painful. I mean, I've actually had that done to my knee a few years ago, and I know what it feels like. And I think that crunchiness that you can even sense and feel, I think it's likely that she's damaged one of her joint cushions.
Right.
It's a very important part of the joint, but when it's damaged like that, we'll end up having to remove it, almost certainly.
Right.
Yeah.
Without surgery, Jemima will never be able to walk normally again.
Certainly the first 8 weeks, she won't be allowed to run around off leash.
Even in our yard?
I would imagine she could pick up some pace in about half a second.
She does,
Yeah.
and also trampolining. She gets up on a trampoline when the girls are on it, and
does she?
Yeah, and then the jumping off.
Yeah, I think Jemima's jumping around on the trampoline days are a little way away. Sends shivers down my spine because she'll do damage for sure. She knows where to go. She's clever.
Oh dear.
Jemima's operation is scheduled for a few hours' time. For Jeanette, it's a reluctant goodbye.
Probably the worst possible outcome. Good.
She'll be okay. She'll be all right.
She's close.
He's almost there, isn't he?
Yeah.
At Werribee Open Range Zoo, Chris and the veterinary team have just sedated Coyote.
Come on, Manny. Just let go.
Right now, what we're waiting for is for Coyote really to relax, to let those drugs take effect and hopefully lie down.
pretty happy with that.
Yep, happy with that.
Can we just make sure that outside gate is closed, just in case he does wake up?
It's now a race against time to get Coyote to the vet hospital. Every minute under anaesthetic greatly increases the risk to the cheetah.
Yeah, a little bit anxious. Hopefully he's going to turn out okay, but anything can go wrong when you've got animals under anaesthetic.
Ready to go?
What we're looking for are any reasons why he suddenly lost his appetite. It could be kidney problems, could be stomach ulcers, or it could be something even more serious.
Are you right if I take this blood down?
Yeah. The results of Coyote's blood work should be back within 30 minutes.
There you go.
They will reveal if the cheetah is suffering any kidney problems. The specialist team also needs to perform a full physical.
We're checking out his joints, but at the moment he's also getting a scope. Now we're going down the esophagus now.
Veterinary specialist Dr. Darren Merritt is performing a gastroscopy to see if there are any internal abnormalities which may be causing Coyote's loss of appetite.
What we're scanning for are any red or I guess irritated or eroded areas that could indicate an ulcer. I'm watching Darren put the scope down through Coyote's esophagus, no problems there, then it hits the stomach, and there's something very abnormal.
What's that there?
Stay there, mate.
At the Hunter Valley Zoo, Horse needs to be moved to another pond so he can find love. But this 3-metre alligator isn't leaving his bachelor pad without a fight.
That's what we want, that mouth open. Jeez, he's strong.
That's it. You got him hooked, mate?
Nah, it's off. Come on, mate.
Come on, mate. Put your head up.
Ready? That's it. You got him hooked? Yep. He's on. Keep that tension on. Girls, could you bring us that second rope, please?
Yep.
You know, this big monster horse here, he's capable of tearing a leg off. But at this point in time, he's a bit vulnerable. He's lost a lot of water in that pool. He's feeling a bit threatened and he's trying to bury. He's trying to get down in that mud to disappear. Come on, big boy, we're doing you a favour. Come on. Come on, mate.
Yourself in the mud.
You're supposed to be happy.
You're going up this roll with that. Beautiful.
Don't want your arm in there, mate.
No, you rip it straight off. Got him hooked at that second rope. Beautiful.
He's on. Girls, do you want to jump in here?
Yep.
Grab onto this rope.
I'll just keep a bit of pressure on him, mate.
That's good.
Don't wrap it around your hands, girls. You'll rip your hands off.
Jeez, he's strong.
He's strong, isn't he?
Come on, mate.
Come on, mate.
Oh, he's stuck.
Yeah.
We're going to need a winch.
Hold it.
It's been 15 minutes and Tim and the team are no closer to moving Horse to his new home.
Got pressure on his head, mate.
That's it. I'll just get these back legs up.
Watch that tail, Timmy.
Right.
Yeah.
These back. 1, 2, 3.
Yeah. We're not budging.
Jesus. This is a big gator. A couple of 100 kilos, and he's got those feet planted. We can't move him.
I mean, this is as loose a knee as you'll get, and you can feel that click and clunk.
At SASH, vital surgery on Jemima's shattered cruciate ligament is about to begin.
See how that goes. We're taking these x-rays so that we can measure what plates and screws that we need. And I'll have them in surgery as well so I can refer to them whilst we're actually putting the implants in to make sure we're getting them in the right position. That's righto, let's go. We just got into the joint. She just totally shredded the cruciate ligament. Now, it takes a huge amount of force to cause this sort of trauma. So she was probably doing 90 miles an hour doing circle work in the backyard when it's gone. And it's just, I guess, blown her knee apart. It's like a 90-kilogram footballer's tackled her from the side and just bent her knee in the wrong spot. It was a mess. The cruciate ligament was trashed, her joint cushion was trashed. So she really put some force around that joint to do that to it. Every time she tried to put it to the ground, it would have hurt like hell.
So we've gone from the esophagus, we're now in the stomach here.
That's right.
At Werribee Open Range Zoo, the gastroscopy to find out what has caused Coyote to stop eating is continuing.
What's that there? Still got bones there? I think so.
Suddenly, the team makes a shock discovery.
Is that hair there?
When Chris says there's fur down his throat, that can't be right. He was supposed to have had nil by mouth last night because he's having a medical examination today, so generally we don't want him to have eaten anything. Bit of a mystery going on.
Those bones there, so that, what do you think that is? Rabbit. That could be rabbit in there.
Yeah. Ex-rabbit.
Is that your concern in any way?
I'm just thinking perhaps some of our concerns were that he's not eating enough, but perhaps he's supplementing his diet adequately.
Do you think there's quite a big chance he's actually getting his own food, feasting on the wild rabbits that are getting into his enclosure?
Yeah, they've been known to catch bunnies on exhibit, but maybe that's what he's done.
It's one of those beautiful moments where all the pieces of the puzzle suddenly fall into place. Rather than being off his food due to illness, he's off his food because he's already eaten rabbits.
I've just got the bottom of it back on.
Oh, here we go.
Kidneys is normal.
Yep.
So all in all, it's a pretty good result considering his age, and what we have learned is what he gets up to after dark.
Well, that's a relief, and it's nice to know that what we've done has been worth it.
Now away we go.
Considering what we could have been facing here, there's a lot of relief in the room, but everyone won't be truly relaxed until we're getting back to his brother.
So we've gone into the joint, taken out the ruptured cruciate ligament, we've taken out the joint cushion that was torn, and now we're going to change the joint angles so that she doesn't need that ligament anymore.
The final stage of Jemima's cruciate ligament surgery is underway. Andrew must insert titanium implants to hold the joint together.
If the angle of the implants is wrong, you just increase the risk of us having a post-op complication such as causing a fracture, which is not great because you've gone in with just a ligament problem, and if you end up with a post-operative complication where you've got a broken leg, that's not ideal. So it's worthwhile taking a bit of time. That's the last one. Just make sure the rest of them are nice and tight. You start closing. That's it. I'm just giving that a manipulation that actually feels nice and stable. It's not sliding forward. So, yeah, that looks really, it feels really nice now. And it's lost its clunk.
X-rays will confirm if Jemima's surgery has been a success.
It looks really good. All the implants are where I wanted them to be, and this plate's sort of running parallel to that bone line there, which is what you have to aim for. That's her new knee, yeah. We have rebuilt it. 1, 2. She won't be able to run around for the next 8 weeks, at least. If she does, she risks blowing her knee apart, and that's a disaster for everybody.
If he only knew where he was going to 3 beautiful alligators, this mightn't be so hard.
It's been a marathon tug of war with giant horse, but the alligator is refusing to budge.
There is no way that 6 of us, 10 of us for that matter, can lift this gator. He's too big. We're going to bring in the big machinery. Can we get that rope on yet? You all right? Yep. That's it, that's good.
Watch out, you're gonna roll, Timmy, watch out, mate.
That's it, let him roll. That's good. It's good. That's a nice pace. Okay, that'll do us for the minute. Before we can tape him up, we need to hose him off because obviously the tape won't stick. You gotta look good for the girls. How handsome is he now? Big set of teeth, beautiful smile. So what we do now is just tie his arms up. It's very comfortable for the gator. This is how they swim. Just means they won't get hurt. We can actually put a couple of straps around him and lift him. Look at that for a hand. There's the wedding finger.
Happy with that, mate? Where do you reckon bring in the cavalry?
Horse has had a noose around his head. He's been pulled out struggling. He's now tied up and he's fighting. He's all clenched. And he can actually have a build-up in lactic acid, and that can kill him very quick. This has to happen fluently.
Okay, looking good.
At Werribee Open Range Zoo, Coyote has woken from his anaesthetic and is now ready to be reunited with his brother in Kasana.
He's just out through that gap. He's been crying for him. He's going to be so pleased to see his brother back.
The medical team was worried the cheetah could be suffering from kidney disease or cancer, but their examination showed that Coyote wasn't eating the park's meals because he was catching his own rabbits.
When you see him skip out of his crate and he lays eyes on his brother, you see him just almost melt. This bond, this bromance the two of them have, it's something that melts your heart.
I'm very happy. It's been a great outcome. Yeah, so very relieved.
Considering we started the day being concerned about stomach ulcers or kidney failure, I didn't think the little rabbit would be responsible for all the drama today. Oh, well. Good outcome, huh?
Yeah, absolutely.
Thanks for joining us.
You guys are champions.
This is really good.
My pleasure.
Beautiful.
Looks pretty comfy there, mate, doesn't it?
He's good. He's good.
At the Hunter Valley Zoo, Horse, the 290-kilo alligator, is on his way to meet his 3 new girlfriends. The other residents are keeping a close eye on the unusual proceedings.
I have never seen a flying alligator. Never. So this needs to be a smooth process. Get him in, let him go. He's got a surprise when he gets there.
I suppose you don't get your boyfriend delivered by air every day, do you?
No. I'd kiss him, mate. Mwah. Beautiful. He's getting his strength back a bit now. That trip actually let him rest. Alligators are romantics. One of these girls will already have his attention. They'll know that from the other side of the park. When it gets dark tonight, things will start and heat up. He's got ropes in the mouth, blindfold on. We've got to get all this off. It's just him and us and let him go. 1, 2, 3. Okay, off we go. Right? Yeah. There you are, mate. You're getting thrown in the deep end.
He looks pretty happy with that, doesn't he?
He's happy. He's heading over to one of the girls. They're in for a surprise. They've been calling, singing to each other for months. But tonight, it'll be all about making babies. A bit of love in the air. I think they need a bit of peace and quiet.
I reckon. Leave them to their own devices, I reckon.
Good luck, mate.
Do us proud.
See? Looking a bit better, aren't you?
At Sash, Jemima has made an amazing recovery after her cruciate ligament surgery. The short-haired pointer is showing no signs of the lameness that was inflicting her when she first arrived.
She came in 3-legged and she's walking out here almost without a limp. And it doesn't get any better than that after that surgery.
In reception, Jeanette and her 2 daughters, Jordan and Courtney, are keen to be reunited with their beloved dog.
That's the most we've been sort of separated from her, so I would imagine she would have been a little bit anxious here too and possibly fretting for us as well.
Here you are. Slow, slow, slow.
Hello. Hey.
Oh, a family reunion. Jemima thinks she's fixed. She's walking normally, but she's not. And Jeanette's going to have to keep her really quiet because she does charge around the backyard. Even once, she could blow all that apart. So they've got to be really careful. It's going to be hard work for them. Trampoline locked off?
That's going.
Right.
That'll have to get pulled apart and gotten rid of because we'll never keep her off it.
I'm very glad the trampoline is going. Might be good physiotherapy for people, but not for dogs.
Wonderful.
All right.
Thank
I'll
you
see you
very
later.
much. Thank
All right,
you.
Bye-bye.
Okay, let's go. Good girl. Look how good she's going. It's amazing.
Rah, 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 rather push, yes.
As for Sydney Brown, he's finally found a permanent home.
Come on.
It was kind of the home we were hoping for, someone who would just walk in and go, yes, that's the cat for me. And so hopefully he's now all settled in and owning the place as he should do.
Brian and Anastasia walked into the Bondi clinic and fell in love.
Our cat Muggins died about a year and a half ago. It took Brian a long time to get to the realisation that it's time for we need another cat.
You want to play, don't you? You want to chase. Oh, yeah, I love him. I love a cat that I can roughhouse with, have a bit of fun. He'll go belting through at full speed, off the couch, onto his little climbing tree. And then when I walk back to about here, I'll hear boom, and he chased me. I turn around, he goes, what? And then he's back into it again. We do that for like a half an hour.
It's been a good result for everyone.
There you go, have a shot.
But Chris is still not off the hook.
Chris needs a cat. We're not going to rest just because one of the cats is now off the list. We just keep working down till we get him to take one, really.
Hi, I'm Dr. Danny. If you enjoyed this video, then please remember to subscribe to the Bondi Vet YouTube channel. Click on the screen now to continue watching more great content.